Secretary, welcome. Kansas, my home state, is one of several states that are facing the impact of a recent measles outbreak. We had 56 cases confirmed measles, with 54 cases being in a southwest part of our state. Among the 54 outbreaks, 48 of those patients were unvaccinated or had unknown vaccination status. Overall, the state's cases, 45 of those patients or victims of measles were children. What do you need? What do you need from us? And what can you do currently to be of help to the Kansas Department of Health and Environment in support of their response to ensure that this outbreak doesn't spread, and to make sure that those who have been positive for measles are cared for, and this becomes a thing of the past, not a thing of the future?
Yes, Senator. The best way to prevent the spread of measles is through vaccination. We urge people to get their MMR vaccines. There are groups in this country that don't want to be vaccinated many of them for religious reasons. I've spent a lot of time with the Mennonites, and the MMR vaccine has millions of fragments of human DNA in it from aborted fetal tissues, and that's a religious objection to them that I have to respect. We need to be able to treat people who do get sick, which the CDC does not give people advice, physicians advice on now, until I came in and we started a new program to treat people who actually get sick. We've done a better job at controlling measles since I came into this agency than any other country in the world. Today we're at 1,035 cases, and we only added 27 cases last week. Canada, which is 8%, 1/8 of our population, has an outbreak double that size, and they added 300 last week. Mexico, which has a population a third our size, has almost the exact number of measles that we do. Europe has almost 7,000 cases, so 7 times what we have. And they're growing and adding cases. We've deployed the epidemic intelligence services to all the states that have requested our help. We have people on the ground in those states, and they are doing a great job at limiting the spread of the outbreak. And if Kansas, the governor of Kansas, wants to contact us, we will deploy a team to Kansas to make sure that outbreak is curtailed there.
Do you have all the tools at HHS to be of help to Kansas and other states?
We do. We not only have tools like vaccination and the tracking and tracing and surveillance and analytics and lab support. We also now are for the first time, are able to provide physicians with at least some treatment protocols so that when children do come to a hospital with measles, there's a protocol for treating them. Most children, virtually no child should die of measles. We've only had 4 measles deaths in 20 years in this country. And even before the introduction of the vaccine, the death rate for measles is about 1 in 10,000. So healthy children should not die from measles, and there's ways of treating most of the kids who died either have comorbidities, but in addition to comorbidities, they have bacteriological infections that are associated oftentimes with measles, and we need to give the physicians the tools to treat those bacteriological infections. And they have not had that. CDC has never given them those protocols because it's one solution only, and it has not been a good system.
You have demonstrated a support for people with developmental disabilities. Could you talk about that commitment to supporting the work of developmental disability networks and how the federal government can continue to support Americans with intellectual and developmental disabilities?
I mean, this is a lifetime passion for me, but also a family passion, and we will continue to provide that support and to provide the best science that we can.
And I want to follow up with something that Senator Collins said in support. I want to share my support for the BOLD Act, the Bold Infrastructure for Alzheimer's Act, and again indicate the value of the continued and intense effort at trying to find the cure and treatment for Alzheimer's. Anything you'd like for me to know?
Well, you know, I alluded to this earlier on, but the NIH really went off the rails on Alzheimer's research 20 years ago. One of the favorite researchers, the part of the old boys club at NIH, developed a hypothesis that Alzheimer's was caused by amyloid plaque buildups. After that, NIH suppressed any science and refused to fund any science
Secretary, I'm out
on
of time.
alternative hypothesis.
Mr. Secretary,
We are
I'm out
going
of
to
time.
change that.
Today, fully committed toward the research to
Yeah, absolutely. We're going to find what causes Alzheimer's, what is causing the epidemic of Alzheimer's, and we're going to find a cure.
thank you.
Senator